Shifting the discussions from the Minister of National Security, we now go across to our sister island, Tobago, where this morning we welcome our contributor and commentator, Dr. Faith B.Yisrael. Dr. B.Yisrael, good morning. How are you doing?
Good morning.
Hi, good morning, good morning. I am fine this morning. It's nice, bright and sunny in Tobago, so we're good this morning.
Yes, well, after last week's situation with respect to the rains and the after effect of such heavy winds and rains, I know that you were very, very busy last week Friday, so we're very glad to have you back on the program this morning.
I'm happy to. I'm just hoping that those families whose homes got, damaged, that we can move a little bit more swiftly in getting them the help that's needed to ensure that they get back their roofs and that kind of thing. It's a process, but it's a process that needs to be sped up, I think.
Yes, very much so. Well, Dr. B.Yisrael, the latest coming out of Tobago, as Sean was pointing out, is that there is an increase in the number of pediatric cases. We even have that discussion as it relates to the ICU facilities on the sister isle. But to the first point in the upsurge of pediatric cases, this also points to something else of which we have not examined too much here in Trinidad and Tobago as yet, which is long COVID. And I know that is something that you have been focusing on.
Yes. So one of the things that you're right, we have not been focusing on a whole lot in Trinidad and Tobago, but it's something that we need to pay a little bit attention to, is the concept of long COVID, or also known as long haul COVID. And what does that mean? We are realizing that for some people, and it's really difficult to determine who those some people are, after they have gotten a COVID-19 infection, long after what we think should be the end of the infection, they seem to still have significant signs and symptoms that have prolonged. Now, some of these signs and symptoms include being very, very tired. They include having pains in your head. And I actually interviewed a lady who has long COVID, and she was infected maybe March last year. And she's still dealing with some of these symptoms, but a year and a half later. She actually says she doesn't even want to use the word headache, because she knows what a normal headache feels like. These are actually just head pains that just feel so strange. Some of the other symptoms are weakness in your bones and joints and that kind of thing. And it's just a very, very strange concept that your entire system seems to be shutting down for a long period after you've been infected. Now, the critical part about this, there are two very, very important parts. For many of these individuals, because of the restrictive testing parameters that we used very early in the infection, they did not qualify to be tested very early. So, for example, this person speaks about getting all of the signs and symptoms is coming out right after Carnival, so in March or so last year. When she called the number to be tested, they asked two questions. Did you just travel? The answer, of course, was no. Have you come into contact with somebody who's a known case in Trinidad and Tobago? The answer, of course, was no. So she was not allowed to be tested at that point, which means that by the time she was able to be tested, because she went ahead and she pursued because she just kept feeling horrible. By the time she got to the point of being tested, by that time, the virus flushes out of your system. And when she kept doing all of the different kinds of tests, she even did a CT, she did this, she did all kinds of blood works, everything comes back as fine. Everything comes back as normal. But when you listen to her speak, she's out of breath. When you hear her talk about trying to exercise, she's unable to do it. When you hear her talk about having this brain fog, where things that she could have remembered, names and places and situations that she knew very well, were now a complete fog, at least for a period. But all of her results, her regular medical checkup results, were normal. So this is something I wanted to highlight because she is not the only one. She has benefited from joining quite a number of support groups online and so forth. In other countries, they have started what are known as long COVID clinics, because they are realizing they have to treat with these symptoms. They are not normal. We are not sure what exactly is happening. but people just don't feel well. Yeah. So Trinbagonians, you need to recognize that if you are experiencing some of these things, that you're not crazy, because it's one of the things she had to come to terms with everything coming back normal. And she's still having to fight with doctors, saying, but I don't feel well. I don't care what that result says. I don't feel well. It's something we need to be very conscious of, and we need to figure out how we are going to treat with it in Trinidad and Tobago.
Well, Dr. B.Yisrael, Sean and I are familiar with long COVID in our research and analysis. We've come across it. We've had discussions with doctors. But interestingly, what you would have pointed out there was early on the qualifications in order to get tested. Could we say reasonably that there is a link between getting tested late and long COVID? In other words, the sooner you get tested and that test results come back as positive, and the sooner you receive treatment, perhaps the long-term effects of COVID may not be as bad.
So I am not sure that is really the case, because remember, for most individuals, even if you're tested positive, you don't get treatment unless you have very severe symptoms, and that causes you to have to go into the hospital. Mm-hmm. I mean, you may take the Panadol and those things, because in essence, they send you home to recuperate on your own. So that may not necessarily be the case. What we don't understand is how this virus actually affects the entire body, because it seems, you remember when we started with this COVID thing, we all thought that it was just a respiratory syndrome, that it was just affecting your lungs and your breathing and that kind of thing. But we've discovered since then that no, it's affecting your entire body. It's affecting your muscles. It affects your heart. It affects your brain. It affects every single part of you. We just haven't figured out yet what's the mechanism. So I am not sure that the delayed testing is the issue, because even for people who we've tested early up, we don't do a significant amount of treatment, at least not in Trinidad and Tobago, for the virus unless you are severely sick.
Mm-hmm. So we started off with regards to the steady increase in pediatric patients. Now, from our research, we know that long COVID isn't limited to adults. It could also affect children. When you consider one of the symptoms being the brain fog with regards to inflammation in the brain, the effects on memory when you're at the age where you're supposed to be learning, we now spoke about the essay results and what happened there. Have you had any cases or is there any concerns with regards to long COVID in children as the cases increase?
Well, we have to be concerned about COVID in children generally, because yes, with these new variants coming out, with Delta coming out, for example, we are seeing much higher cases in children all over the world. And this is not just in Trinidad and Tobago, this is all over the world. So yes, it is something we are going to have to look out for. It is something that we have to, kind of warn parents about as well. Because, we are kind of a society where children are just supposed to do what we tell them. And if they don't, we classify them as rude and bad and that kind of thing. So particularly parents with children who've had COVID, please look out for this. Your child may not be lazy. Your child may not just be being bad. They may really be actually experiencing long COVID, where they're actually lethargic, where they are so tired they can't study, where they have brain fog, so they can't, they can't memorize the things that we want them to learn and all of that. So it's also a warning to parents to look out for these signs and symptoms in your children.
Mm-hmm. But then now there comes the next question. Because you have the situation where there's probably going to be more of a push to get in-classroom schooling. The government has said, well, only vaccinated, which I agree with, because we have to now consider, with the rising rates of infection in children, the concern, or my concern would be that if we have schooling, they could be a vector for one household to pass COVID on to another household. Would you think that's a fair concern now, particularly with the infection rates rising now?
Yeah, that is a critical concern, and it's one of the reasons why we have been pushing for people to follow all of the recommendations to prevent COVID-19 infection. All of the recommendations include, of course, washing your hands, include social distancing, wearing your mask. If you are sick, please stay home, because we still have people who are feeling sick and going to work, and definitely get the vaccine, because we have data from all over the world showing that the vaccines are actually working, showing that they are reducing your risk of getting infected. And even if you do get what is known as a breakthrough infection, the vaccines are working in reducing your risk of getting very, very sick or even dying. So yes, everyone, we just saw a note from Cuba, for example. Cuba actually just started vaccinating their entire population from 2 years old. Cuba just started giving vaccines, COVID-19 vaccines, to from 2-year-olds and up, because they understand how important this is to prevent it from multiplying the way it has in the country. And, you know, it's, of course, they are using the vaccines that they created. We don't have the Cuban vaccines in Trinidad and Tobago just yet, but that tells you they are already doing it. They already understand the need and the importance of getting the vaccines and getting the vaccines to people, as many people as possible, even including children.
Well, Dr. B.Yisrael, interestingly, you know, we've recognized long COVID. We've recognized that syndrome. However, there has not been a focus on it, as we would have pointed out at the beginning of this conversation. And therefore, we are yet to really see the long-term effects it could have really on an individual, perhaps spilling over into society, perhaps even the labor force, the workplace, just generally that effect on society, on the population. So we don't really know to what extent this could also affect our socio-economic perspective here in Trinidad and Tobago.
Certainly, and that tells you that the potential fallout of this COVID-19 thing is, you know, we are going to be dealing with this for a long, long time to come. One, we are dealing with the socio-economic aspect of it now, where we've had to shut down and all of that. Yes, but we also have to deal with the psychological aspect of it for people who've gone through the last year and a half, and that is going to take some time to recover from. And now we have to add this concept of long COVID as well, where, you know, and we don't know how many people it's going to affect. We may actually get some of our population, some of the people who should be in the working class, in the working category, not being able to produce as much as they can because of how badly they have been affected. And by the way, one of the things that I am recognizing is that the people who seem to have the most significant effects of long COVID are those who they tell you the day before they felt they got sick was the healthiest they've been. You know, one of the people I interviewed, she actually said she, at that point, that was the healthiest she had actually been. And she actually recognized she was sick when one of her exercise periods, she said to herself, something doesn't feel well. I don't feel well. Let me stop exercising. And this is somebody who was exercising 4 or 5 times a week. And since that point, she has not been able to get back to that just yet. And this is a year and a half later. So we are seeing where, you know, we are not sure why that is the case, why somebody as healthy as her had these kind, because she did not have any of the other, you know, non-communicable diseases or anything like that as far as we were aware of before getting sick. So again, it's a perfect reason why people need to do everything in their power to ensure that they don't get infected at all, because we honestly don't know what are the long-term effects of this disease. We honestly don't know.
And because we don't know that, we don't know whether or not we're prepared to deal with it as well here in Trinidad and Tobago.
Yeah, the costs when you take the aggregate of all of these long-term effects might be considerable. But with that, I have to ask, because it was reported that Tobago's vaccination levels have now reached, I believe, around 19,000. I'm not sure if it's first or second dose. So at 19,000, right, partially vaccinated, 14 fully. But if you get one dose, you know, more likely than not, you'll get the second dose. So Tobago's on track to reach at almost a similar level to Trinidad, about a third of the population that you need vaccinated. What do you make of that? Are you happy for that? Do you think that the situation is getting better? Because the Prime Minister, he came out with regards to the vaccination rates of the Sister Isle. And he said he was disappointed by it. How do you feel about the vaccination rates there?
I think that we are getting there. It's nowhere close to where it needs to be. It's absolutely nowhere close to where it needs to be, but we are getting there. And I go back to reiterating the fact that people call me, people message me, people meet me all the time and ask me critical questions. So when we have vaccine hesitancy, it is because people have honest, genuine questions that they need to be answered, and then they can make a decision. I have spent so much time, all the time, answering questions for people, and then they say, okay, yeah, I feel good now, I feel okay now, let me go get the vaccine. And I think that is where we need to spend the time, getting to people, individual people, smaller groups of people, so that they can actually ask the questions and get answers to their questions, and then they can make the decisions for themselves. That is where we need to get to. It is sad that we spent so much time just cussing and buffing people, and we did not take the time earlier to actually get to that point sooner rather than later. But I am happy that we are here now and that we are taking the time to listen critically to people's concerns and address those concerns.
Well, Dr. Faith B.Yisrael, we only hope that continues going forward, and we hope that there's a bit more empathy rather than just that buffing that we have gotten accustomed to. But Dr. Faith B.Yisrael, I want to thank you very much for joining us on this edition of Talking Point. Always a pleasure having you join us on the program, and very glad to know that there is a bit of positive to end things off in terms of this discussion. So thank you very much.
Thank you for having me. See you guys next week.
See you next week.
Doctor.
Keep well, Dr. Faith B.Yisrael. Thank you.
Thank you.
Folks, we take a break here on Talking Point, and when returned, we just highlight that story once more related to the ICU facilities in Scarborough, and then we go into the discussion related to what took place around the Queen's Park Savannah yesterday with what is being described as a walk for prayer. Stay tuned to the program on WESN Content Capital.